In celebration of Cervical Health Awareness Month, we are here today with Dr. Whitney Lieb, an assistant professor of obstetrics, gynecology, and reproductive science at the Icahn School of Medicine. She's a member of the Blavatnik Family and Women's Health Research Institute, and she's an attending at Mount Sinai Hospital in OB. Thank you for being here with us today.
Thank you so much for having me.
What would you like people to know about for Cervical Health Awareness Month?
So cervical cancer used to be the leading cause of cancer death for women in the United States. However, in the past 40 years, the number of cases of cervical cancer and the number of deaths from cervical cancer have decreased significantly. This decline largely is a result of women getting regular pap smears, which can find cervical precancer before it turns into cancer. However, it's important to note that cervical cancer is still the fourth most frequent cancer in women around the world, and approximately 90% of deaths from cervical cancer occur in low and middle income countries. This high mortality rate from cervical cancer globally could be reduced through a comprehensive approach that includes early diagnosis, effective screening, vaccination, and treatment programs.
What is cervical cancer?
So a woman's cervix, which is the opening of the uterus, is at the top of the vagina. It's covered by a thin layer of tissue made of cells. This healthy tissue grows, divides, and is replaced as needed. Cancer of the cervix occurs when these cells change. They may grow into deeper cell layers or spread to other organs, and the cancer eventually forms a mass of tissue called a tumor.
How long does it take for cervical cancer to develop?
It often takes several years for cervical cancer to develop. During this time, the cells on or around the cervix become abnormal. The early cell changes that occur before cancer is present are called dysplasia, or cervical intraepithelial neoplasm.
What is the main cause of cervical cancer?
The main cause of cervical cancer is the human papillomavirus infection. There are many types of HPV. Some types of HPV, called high-risk types, can cause cancer of the anus, cervix, vulva, vagina, and penis. This can also cause cancers in the head and neck and throat. Other types of HPV can be linked to genital warts.
How can I prevent the human papillomavirus infection?
A vaccine is available that can prevent the infection with HPV. The vaccine protects against HPV types that are most common causes of cancer, precancer, and genital warts. The ideal age for HPV vaccination is 11 or 12 years old for both boys and girls, but it can be given as early as 9 years old throughout age 26. And in October of 2018, the US FDA approved the human papillomavirus vaccine for people aged 27 to 45. And experts are now discussing how and when the vaccine should be offered to adults. In the meantime, if you are older than 26 years old and interested in getting the HPV vaccine, talk to your healthcare professional.
Who is at risk of cervical cancer?
The most important risk factors for cervical cancer is the infection with the types of HPV infection linked to cancer. The following factors also increase your risk of becoming infected with HPV: multiple sexual partners, having a male partner with multiple sexual partners, early age in which you initiate having sex. Other risk factors include smoking, a family history of cervical cancer, and a personal history of cervical, vaginal, or vulvar cancer, and any problems with your immune system.
Is there a screening test for cervical cancer?
Yes, the pap smear checks for abnormal cell changes of the cervix. This allows for treatment so the abnormal cells do not become cancer. An HPV test is also available. This test is used along with the pap smear to screen for cervical cancer in some women and as a follow-up test when a woman has an abnormal pap result.
Who should be tested for cervical cancer?
Every woman over the age of 21 years old should be tested whether they are sexually active or not. Women 21 to 29 should get tested every 3 years, and women 30 to 65 can be tested every 3 years or every 5 years, depending on which type of testing they receive. However, if any of your tests are abnormal, you'll need closer follow-up.
What are some of the symptoms of cervical cancer?
The first signs may be abnormal bleeding, spotting, or watery discharge from the vagina. Menstrual bleeding may be heavier than usual, and bleeding may occur after sex. Signs of advanced cancer can include pelvic pain, problems urinating, and swollen legs. If the cancer has spread to nearby organs or the lymph nodes, the tumor can affect those organs as well. For instance, a tumor might press on your bladder or block flow in your veins and vessels.
How is cervical cancer diagnosed?
If your healthcare professional suspects that you have cancer of the cervix, a biopsy may be done. For certain abnormal Pap tests that require treatment, the abnormal cervical tissue may be removed and sent to the lab to be studied. If cervical cancer is diagnosed, your healthcare professional will assess the size of the cancer and the extent, if any, to which the disease has spread. This process may include tests such as a pelvic exam, a cystoscopy, which looks at the inside of your urethra and bladder, or a colonoscopy.
What is staging?
Staging is the process of finding out how much the cancer has spread. Most types of cancers, including cervical cancer, have stages from 1 to 4. The lower number, the less cancer has spread. Some types of cancer, including cervical cancer, have a stage 0. Stage 0 also is called non-invasive cervical cancer or carcinoma in situ. In stage 0 cancer, cells are present on the top layer of the cervix only. They have not gone into the deeper layers of the cervix or tissues or other organs. The remaining stages are called invasive cancer. In these stages, the cancer has invaded deeper layers of the cervix.
What are the types of treatment for cervical cancer?
The treatment options for cervical cancer may include surgery such as hysterectomy, radiation therapy, or chemotherapy. The type of treatment chosen depends on the stage of cancer, and you may receive more than one type of treatment.
What disparities exist in cervical cancer and HPV?
African Americans, Latinos, American Indians, and Alaskan Native American women continue to be disproportionately affected by cervical cancer compared with white women. The mortality rate for cervical cancer in African American women is twice that in white women. Although cervical cancer rates have decreased nationwide, significant racial health disparities persist.
How can we work towards reducing these disparities?
So that's a very difficult question, but education, screening, HPV vaccination, and follow-up on abnormal screening results are ways to help start reducing the disparity in women.